會咁今日台上面兩位醫生分別係衞生防護中心傳染病處主任張竹君醫生，同埋醫管局總行政經理劉家憲醫生。
Dr. Chang will brief us on the number of cases. As at last night, we had 10 new confirmed cases. A number is 114, 112, 114, 24 female and 6 males aged between 18 and 56. Am I coming through? Last night we had 10 new confirmed cases. Case numbers 11411 11420. There are 4 females and 6 males aged between 14 and 56. Am I coming through? Last night, we had 10 new confirmed cases. Case numbers 11411 11420. There are 4 females and 6 males aged between 14 and 56. 6 are imported cases, including 5 from India on AI 1310 arriving on the 22nd of March. 3 of the variants are M501Y. We've got 1 imported case from Pakistan arriving on the 17th on EK384 and detected during quarantine period. Together with the 3 M50Y variant, there are 116 variants of concern. 44 the UK variant, 9 South African, 5 are similar to the Brazilian variant, 49 have yet to be classified. Another 5 cannot be classified because we don't have enough, the samples are not big enough, etc. There are 4 local cases, including 1 with no known sources yet, another 3 linked to other cases. Among the 3, we have got 1 linked to URSS as a close contact of a customer, of a client of URSS, and also confirmed at the quarantine center. There are a total of 151 URSS-related cases, 8 staff members, 94 clients, and 49 close contacts. 2 cases linked with other cases. We have only 1 case where the source cannot be identified yet. It's a 54-year-old male working for Wofeng Industrial Center in Kuaiting, delivering men together with a staff member and also a family member. They deliver goods, and sometimes they help to set up furniture, assemble furniture. On the 21st of March, he felt uncomfortable, and also on the 23rd, he was confirmed. And then he lives in Wangpo and phase 3. In between the 13th and the 22nd of March, he delivered goods to about 20 households. And for most cases, he just left the delivered goods. And for some of the cases, he stayed longer to assemble the delivered goods. And for persons who had a longer contact with him will be sent to the quarantine center. There are about 10 households involved. We'll check what family members were at home when he was there. He lives in Block 6 Willow Mansions of Wangpo Garden in Hong Kong, and the building will have to be subject to mandatory testing. The related cases has got a building that will be subject to mandatory, that is Block 7 of Scenic Heights in Taiwan. Now, in the linked cases, there are 2 workplaces. That is, other than close contacts at home that have been sent to quarantine center, there are some colleagues at work that have to be sent to quarantine center, including the second floor of Kowloon West Regional Police Headquarters in Argyle Street, number 190, Kowloon City, and also Pao Yu Kang Library of Polytechnic University in Hong Kong. We have less than 10 preliminary positive cases, most of which are imported cases or detected at quarantine centers. They are mainly family members of cases related to URSS. That is, they are close contacts of clients of URSS fitness. I have no other cases to report. Dr. Lau, please report to us the situation with the hospital authority. As at 9 a.m. in the past 24 hours, DHA has reported 23 cases. In the past 24 hours, with another 27 confirmed cases recovered and discharged. So far, 10,963 patients have recovered and discharged. As at 9 a.m., we have 212 patients being treated at 11 hospitals and the Northland Hospital Infection Control Center. 10 are in critical condition, 8 are in serious condition, and 194 in stable condition. So far, we have opened 1,202 negative pressure beds. Utilization rate 57%. Number of negative pressure was 662. Utilization rate 67%. That's all I have to report. Question time, please raise your hand and we'll pass you the microphone. And before you ask questions, please identify the organization you represent. The gentleman in the third row. Good afternoon. I'm from Commercial Radio. Regarding the 55-year-old man with a known source of infection, he started to develop symptoms on the 21st of March. I'd like to know the symptoms. Has he ever consulted any doctor and any test done? If not, well, in between 7 and the 23rd, I'd like to know whether the risk of infection is high or not. Although he didn't stay behind to assemble furniture for some households, will these households be subject to mandatory testing or quarantine? And how do you assess the risk of super infection? Well, on the 7th, he had some muscle ache, but not so serious as to warrant immediate medical consultation. On the 21st, his family member submitted a sample on his behalf, and it's now a confirmed case. And may I remind members of the public once again, now if you feel unwell or if the situation is unstable, please consult a doctor as soon as possible and submit a sample for testing. For delivery personnel, usually people will be wearing masks and people will not be regarded as close contacts. However, he was working during the infection period, and for households where he he stayed for more than 15 minutes, although everyone was wearing a mask, we thought it was safer, we feel it's safer to send people to quarantine center. But for cases where he just delivered the goods and go and went and left, I think the risk is similar to what you see in the shop. So we've informed these households to be tested to play safe. The lady in green cardigan.
Apple Daily. About the 55-year-old male with a known source, just now it was mentioned that onset was 17th, and then there were 10 units which had been would have to be quarantined, and 22 had been contacted. Now, you said that it was from the 13th to the 22nd of March. When do you start counting the days? 2 days before onset, or what? And then for the Kowloon West Regional Police Headquarters, second floor, which case is related to this one, and how many persons are related? Well, before the 13th or so of March, he did not have a lot of goods to deliver. So as far as we know, it was be the 16th, the 17th, 18th, 19th, 20th of March. Those are the related dates, not all dates. Every day there will be 2 households related. And altogether, I think there will be just over a dozen people, and at the households it would be 1 or 2 people present at the house at the time, or at the most 3-4 people. So those are the numbers. As for the mandatory quarantine persons, one is a family member, and he or she reports to work at the Kowloon West Regional Police Headquarters. Now, after being checking into quarantine, mandatory quarantine, and the last day of work was the 18th, he was proven to be positive, and the March 20th sample was very high in CT value, and it was uncertain about the confirmation. And after that, after checking into a hospital, it was found to be positive, and the antibodies also showed positive COVID as well. But because the first sample was uncertain, it was on the 20th, and it is very close to the last day of work, which was just 2 days apart, and therefore, to be safe, for the second floor colleagues in the Kowloon West Regional Police Headquarters, they have to go through mandatory testing. I do not have further details about this. Yes, they're mostly police officers. As for contact with citizens, I will have to find out. The last row, the lady over there.
News. First, about the untraceable case today. Can authorities tell us a little bit about the risk of transmission when it's related to families that just involve delivery done? Is the risk particularly high, or it's like minimum to none at all? And why is it more risky when the man actually helped install some of the furniture? And also, when authorities are going to quarantine those families they have visited, are you guys just going to quarantine people they came into contact with, or everyone living in those flats? And if it's just those they came into contact with, why is not everybody living in those flats quarantined? And second question is related to the mandatory testing order linked to the Kowloon West Regional Police Headquarters. Can you tell us a little bit about why that place is put under this order? Thank you.
It's very difficult to quantify the risk, whether there's a high or low risk of spread to the households, and he worked during the communicable period. But because he did work, he had onset of muscle pain on 17th, and he's still working until 23rd. So during this period, he has sent goods and assemble furniture in quite a number of places, and many of them he stayed, and he and his colleagues stayed for more than 15 minutes. Although all of them had wear masks, claimed to have wear masks during the delivery and also assembling of the furniture, but this is a home setting. Usually the space would not be very big, and we are afraid that if he is transmissible, sometimes even he wears a mask, there's still a risk of transmission to the people who came into contact with him and stay in the same flat, for a period of time. So we will quarantine those who stay in the flat during the period he stayed together. So it's around 10 or more and members of the public who had received the goods from him will be put into quarantine. And for the mandatory testing of the Argyle Street Police Station, he's a close contact of the cases in the family, and he has been sent to the quarantine center since 19th of the March. His last working day was 18th of March. He was asymptomatic, and a sample taken on 20th of March was tested indeterminate at that time with very high CT value, and he was admitted to the hospital for recheck and retake the specimen. And until I think it's around 22nd, his specimen was taken to be primer positive and finally confirmed. And also his immunoglobulin, his antibody is also tested positive. So because he stayed, he worked within the communal period. If we take the first specimen as infective on 20th, there's still risk of spread in the place he worked. That's why we issue a compulsory testing notice to the place, just like the other workplaces. Oh, no. It's only those who stayed with him while he's working, yeah. Because we still think that it's more likely for the person-to-person transmission. I mean, after he left the place, there's no reason for us to suspect the other family member who came back to be at risk, unless those family members become cases. But of course, they will be under compulsory testing notice because the family members who are considered as close contact, I mean, if the close contact have been sent to quarantine center, their family members are, if not present at that moment, are compulsory to test.
嗰邊後邊白色衫位男士先。
The gentleman at the back, AM730, AI 310. Does it have to stop flight? And what about the delivery staff? How many persons need to be tested? And where are these units or households, the buildings? Do they have to go under mandatory testing? Now, for assembly of furniture, are these large pieces of furniture or small? And would he be sweating, or would there be secretions during the process of assembly? And then there is a library concerned for a confirmed case. Will he be handling a lot of books in the library, or will he be coming into contact with what? AI310, there were 5 imported cases in the same day, so it would have stopped flight last night because cases were confirmed last night. So yes, it will be it will stop flight. As for the delivery addresses, the worker going into the households for assembly of furniture, the furniture pieces, some would be bigger, some would be smaller. He would stay 6 minutes or 3 minutes or all the way to 15 minutes or 20 minutes in each household. They're different each time. Tai Po, Wan Chai, Wong Tai Sin, Yuen Long, Sai Kung, all addresses. So everywhere around Hong Kong. And these buildings do not need to come under mandatory testing, only for the households. But of course, if there are confirmed cases, of course, the buildings will have to come under mandatory testing. As for the library staff, basically he's working within one room and he doesn't have to come into contact with library visitors. But for staff who come into contact with him, they will have to go to the center. As for the library itself, perhaps a lot of people would stay for over 2 hours or so in the library, including students. We would want them to go through mandatory testing as well.
That's his own company. So there is only himself and a family member and a driver. The speaker did not come through. Yes. Apart from his contacts at home, because he is a case with no known source, during the infection or incubation period, he had met with friends and also ate with them, and there are a few of these friends that have to be quarantined. Good afternoon. I'm from Mingpao. For the man whose source is unknown, I'd like to know whether he has got any high-risk factors. Dr. Zhang said that during his incubation period, he had met and eaten with friends. What are the places? And what about the chill food cuisine? I'd like to know whether there are new confirmed or preliminary positive cases associated with this restaurant. I'd like to know whether the 88-year-old man had any contact with the other two confirmed cases. The third question is for Dr. Lau. The government has before suspension of BioNTech vaccination. I'd like to know the number of people that have received the vaccination through HA's vaccination centers. We do not have any new case associated with chill food cuisine now. According to the restaurant, they have 28 staff members. I thought it was 9. In fact, it was only 7. Were sent to quarantine center, and the remaining 21 have been tested negative. We cannot confirm whether the 88-year-old man. We cannot establish the relationship with the other 2 confirmed cases yet, and we've yet to identify the source of infection. But investigation of the 88-year-old man hasn't been too thorough because he doesn't have a good memory. The case where the source of infection is unknown yet, well, he has met with friends, eaten with them, and checked it with them. Not involving very big gatherings, but he has had meals with friends. Both secretaries and the director came out to provide information regarding the vaccination, and I have no further information on our vaccination centers yet, so I have nothing to add. Next, the reporter in white in the third row. I'm from Cable. For Wofu Industrial Center, I'd like to know whether people have to be subject to mandatory testing. Is Wofu Industrial Center because the confirmed case has an office there, but all his contacts have been sent to a quarantine center, and so no mandatory testing is required. I'm from RTHK. Dr. Zhang, can you give us the detailed address of the 55-year-old man who's a confirmed case today? And will the Department of Health require Ursus Fitness to improve its ventilation system before it can be reopened again? And will there be requirements on infection measures? For instance, will gyms be required to improve their ventilation, just like restaurants before they can open again? And because of the suspension of vaccination with BioNTech, will that undermine the confidence of people, our people's confidence in vaccination, whether the vaccination rate will drop, and what will be the impact on our fight against the disease? Well, the office is Wofeng Industrial Center in Kuaiting. All workers and its office have been sent to a quarantine center, so there shouldn't be any possible outbreak in the building. Usually, for fitness centers, if the ventilation is poor, because people are there to do exercise. When you exercise, there is easy to produce aerosol. So if ventilation is poor, that is far from desirable. I understand that the Bureau is looking into this matter. For vaccination, I have no more to add. If there are no other questions, then the PCN's here. All right, one last question. I'm from HKEJ. I'd like to ask a question related to conformity vaccine. Before the manufacturer notified the government of the defects, has anyone discovered any defects associated with vaccines? I have nothing more to add in relation to the